And it's another day with fertility specialists. Yeah, thank God it's Friday and it's weekend. Happy weekend to you all, our dear viewers. Thank you for liking our post. Thank you for sharing. It's always good to have you guys with us. Today we'll be talking about fresh embryo transfer and frozen embryo transfer. Which is better? Which would you prefer? So, for the sake of someone joining for the first time, we have a special guest. He was with us on Wednesday. So, for those of us that were with us on Wednesday, you're familiar with his face now. We have Mr. Stephen Olarinde. Mr. Stephen, it's good to have you.
Thank you for having me.
You're welcome. So, for the sake of someone, like I said, watching for the first time, a bit about Mr. Stephen. He's an embryologist, a senior embryologist at the matter, also the head of the embryology unit at Alps Hospitals. So it means that we're talking about embryo. We're just talking about, should I say the head of the embryos now? Oh yeah. So it means we couldn't have had a better person talk about embryo transfer than the person we have right with us this afternoon. So please stay tuned. Drop your thoughts, your comments, your questions in the comment section. Even as we get started, share this link with as many people as you can so that those people that also have wrong impressions, they'll get to hear what is real and the real facts, and they're able to debunk whatever wrong notions they've always had with respect to the forms of embryos that I'll be embryo transfer that I'll be talking about today. So, Mr. Stephen, we're talking about frozen embryo transfer and fresh embryo transfer. Well, what's actually the meaning of a fresh embryo transfer? When you say fresh, and this with well, a lot of things come to mind when you say fresh. Well, so well,
Mm.
maybe just give us a brief.
So, in that context, when we say fresh, you're looking at a patient walks in for IVF.
Mm,
You start IVF is in different stages. So,
yes.
from egg collection to treatment. So, from treatment, this you culture these embryos for 3 to 5 days. So, at the end of the treatment, when after oocyte collection, the transfer that happens either a day 3 or a day 5 transfer. That is what we call fresh embryo transfer.
Oh,
So
okay.
if you're talking about the frozen embryo transfer, so it could happen probably somebody had a treatment like this and there are surplus embryos.
Okay.
So we freeze some to keep for future use.
Yeah.
Then it could be medical condition,
Mm,
probably maybe from um, lots of OHSS, that's ovarian hyperstimulation syndrome. So because of a medical condition, instead of going ahead to do the embryo transfer, you keep the embryos so that the body of the woman recovers when the hormones level in the body are down before the embryos are now thawed and transferred. So when you freeze the embryos and you have to thaw them before doing the transfer, that's the frozen embryo
embryo transfer.
transfer.
Okay, so viewers, hope we've noted that for those people that say, okay, I want to have frozen embryo transfer, and then maybe you get to the point of egg retrieval. Okay, so when am I going to have the frozen embryo transfer? So that explains why you some of you have your embryo transfer fresh and some people have frozen embryo transfer. Well, yeah, we'll talk a bit about this frozen embryo transfer. At what point do you freeze embryo transfer? Like what I mean, when you treat, when do you say the embryo is fit to be frozen?
Frozen. Okay.
Mm,
So on the day of the transfer, which could be the 3 or the 5, the embryo are being assessed for their quality. So we grade them. We call them grading the embryos according to the quality.
okay.
So if it's for someone that has surplus embryos,
Yeah.
you advise them to freeze. So the excess, the a fresh embryo will be done for the person,
Mm.
but the excess embryos remaining will be frozen for
Oh,
later use
okay.
in case probably pregnancy did happen
Mm.
or pregnancy happens and there's a miscarriage. So we recommend that. Then for people that have OHSS, that the response was high. Now, high response comes with different hormones too that be built from the body, the estrogen, the progesterone. So this high response also does affect what we call the implantation window.
Okay.
because as these response are high, the follicles produce estrogen. After you take the corpus luteum
Producing
also produces progesterone.
progesterone.
So all these things affect the implantation window. So when you have a condition like this, you advise the patient to freeze embryos such that when the hormones in the body are less, her
Mm.
chances of achieving success is higher
Yeah.
with that particular one. And it must be important to note that when we talk about freezing embryos, we don't put them in the freezer
Mm.
or we just put them in. No, the embryos are put in cryoprotectant. We pass them through cryoprotectant, then they will be frozen using your liquid nitrogen and stored at minus 196 degrees. So that's the temperature for the liquid nitrogen. We use that to freeze these embryos. It's like you are just pausing the growth of the embryos, and then you're
Mm.
storing them for when it is required. Then you thaw them, bring them back to life. That's the
Nice.
playing them, and
Mm.
then transferring to the woman for growth to happen and then pregnancy to happen also.
So, are all embryos freezable? Because I know there are people that will tell you that I don't want to do an embryo transfer and I just want to retrieve my egg, treat with the sperm and freeze the embryos. And then maybe you're telling them, well, yeah, maybe you are giving them something not too palatable. Yeah.
Okay. So for usually for patients that are of younger age,
Mm.
the and looking at the gamete quality, the oocytes, the sperm, if they're of very good quality, there's no challenge with them. Usually the lab is doing very fine. You should have good quality embryos for transfer. But it's also important to know that not all embryos are suitable for freezing because you'll be passing them through. You can see the stop stage and the temperature. So not
Yes.
if the quality of the embryo is not very great, they will not survive the freezing. So
Mm.
the quality of the embryo has to be great. Once the quality of the embryo is good, that's where the assessment and the grading of the embryo comes in. You assess to grade them to see whether they are viable enough to be frozen. So not all embryos are good for vitrification, but for the good quality ones, of course, you can go ahead and vitrify them.
So, hope viewers, there's a lot to take from this. For some people that might have actually gone through IVF, maybe you were told at some point that they feel it's better for you to have a frozen embryo transfer than to have a fresh embryo transfer. And then this is somebody that's already imagined that in 2 weeks' time she'll be pregnant. And then they are counseling you that we think you should freeze the embryos. We think it's going to be of best interest to you. So Mr. Stephen has made us understand why sometimes this counsel of freeze all embryos is actually given to increase your chance of succeeding. Of course, yes, it's possible that you could still go ahead with that transfer and succeed, but it's also most likely possible that you could go for that embryo transfer and fail. So and that's why you don't compare yourself with another person. Another person, they might tell the person might say, I want a frozen embryo transfer, and they're telling her the embryos are not good enough for freezing. And then they will have to say, okay, we think it's better to go
For
ahead
a
and do
fresh
a
transfer.
fresh transfer because these embryos might not survive the whole process of freezing and throwing it back to put into you. And then this is another person wanting a fresh transfer or wanting a fresh transfer. And they are saying, please, we think it's best for you to have a frozen embryo transfer. So circumstances differ for
Yeah.
people. And for like you mentioned, for someone that they are telling freeze all embryos, maybe you're even having the OHSS as they actually explained, and then you are sickness, and then you're already not feeling okay, for instance, and
Mm.
then you want to still proceed to have pregnancy that will further make you sick, or you might not even achieve the pregnancy to begin with. I
Yeah.
mean, it's good if you are hoping to achieve pregnancy that you are first of all fine before you now talk
Yeah.
about pregnancy that could even exaggerate symptoms if you actually even achieve pregnancy.
It's also
Well,
important to note that for people that will be doing a PGT treatment, of course, embryo freezing is definitely frozen embryo transfer is what they would happen at the end because
mm,
you are treating these embryos, then you analyze them. So in the process of
mm,
analyzing and waiting for results, you freeze these
yes, the
embryos. So
embryos.
when you have your result back, you look at the this result and then you go back to check to match the embryos. For example, whether it's for sex selection, for gender balancing, for
Mm,
example, maybe XY or XX, you go look at these embryos so you can pinpoint which is perfect for which, and then they undergo frozen embryo transfer. So for PGT, yes, that is the standard baseline. For if you're going through that treatment, that's why the treatment can be long because it's very technical and involves a whole lot of things where biopsy, the embryos are first biopsied, frozen, then analyzed before you now come back to do a frozen embryo transfer.
That's far. So, what's your opinion to people that feel that when you're freezing embryo, you're freezing babies, or you're freezing life, or some people say when you are discarding life, or you are killing a baby or something? What's your opinion to that? Because I know there are some people that actually have this
Yeah.
extreme notion.
So it is important to note that there is nothing you would do for a patient that you don't authorize us to do. That's where the consent play a role. We are here to guide you medically and tell you, okay, you have excess embryos. We suggest you freeze them. And if you're not picking up the option of freezing the excess embryos, you're picking up the option to discard your excess embryos. So, of course, once the patient authorizes us to do that, she is the owner of the gamete. She's just giving us the moral obligation to go ahead and do what we have to do. So, once the consent is there to guide you, you do what you have to do because the person is instructing you. It's like you go to a bank now and you need to cash out your money. You have your money in the bank. Of course, whatever you write on your check, the bank is obligated to follow that instruction. You don't walk into a bank and say, I want you to give me 10,000 naira, and the bank gives you 1,000 naira because they feel like, no, the instruction you gave us is what we go ahead to do. So we will just guide and advise appropriately.
Do you feel that they are discarding babies? Because that is the
So
notion
the,
some
the
people
notion
have.
of discarding babies, yes, embryo is a potential baby. They have the potential to actually form a baby, but they are not yet babies yet. They're not
They
babies
don't
yet.
have
So
life
they
yet.
don't have they have life in them, but you won't say they are babies. You can transfer the embryo and pregnancy does not happen. So
Exactly. So
how
it
do you
means
come
that's
up with that?
wasted.
Is it
Exactly.
life that that is living that you put here and just die? So is a potential to become a baby. It's there for them. So when whether you discard or you freeze, whatever it is, there's that chance that yes, this is life, potential life you're dealing with, which can happen due to the God factor. Because yes, you can have the best embryo and then pregnancy may
Still
not
doesn't
happen,
happen.
and you may have the not so good and pregnancy happen. That is the God factor in all this treatment. As much as you put in your effort to give the client the best, there's also the God factor in it that makes whatever you do
Work out.
successful. Yeah.
Okay, so viewers, hope you are taking notes of that. Yes, the fact that there are embryos that have ability to actually become babies. They are not yet babies. Yes, as much as it could get into someone and eventually when they implant into the womb, I think that's when they
That's
now
when
have
yes, they
life.
become
Yeah,
babies.
exactly. But really, actively looking at it, it's not like, okay, yes, as much as they are developing, but you wouldn't say they are I
There
don't
are a
want
lot
to
of
say
stages for the embryo
yes
before they become babies,
and all
and
of
that's
that.
why many countries have different laws governing this particular the type of embryos you freeze, the amount of years and duration you should freeze those embryos. So there are different laws guiding this particular thing and strict ethics that you don't play with.
Okay, so viewers, well, that's a bit of it. And then yes, some people have this notion that pregnancy outcome with fresh embryo transfer is higher. So well, what's with your experience over time? Is there a difference between the fresh embryo transfer and a frozen embryo transfer, or they are just situational? Um,
Well, yes, some research has shown that with fresh embryo transfer, there's more positive outcome. Some
oh,
research has shown that, and that research was out last year to show that there's no difference between a fresh embryo transfer and a frozen embryo transfer. It's just the situations that come in, and when you look at it, for somebody that has a lot of embryos, you're freezing extra. You can go with the fresh transfer. She gets pregnant. Maybe years after she comes back, she takes the frozen one. She gets pregnant again and achieves success. But research has also shown that people that have frozen embryo transfer, they are less predisposed to preeclampsia. So and then preterm birth is not. They are less disposed to having their babies preterm.
oh,
Yeah, less than 37 weeks. That's for those that have frozen embryo transfer
okay.
because they don't have to deal with the low birth weight, battling with low birth weight and the pregnancy induced hypertension
Oh,
that these babies suffer compared to the fresh embryo transfer.
wow.
So in some cases, but what the basic thing to look at here is the body you're dealing with. of course, when you are likely to achieve more success with frozen embryo transfer because for somebody that has undergone stimulation, HRT, and all these things, where there are a lot of hormones that could be up and down, they are not
Yeah.
controlled.
Mm.
So that can play a role in your pregnancy outcome.
Outcome.
But for somebody that the oocytes are gotten treated, the embryos are generated and frozen, then you allow the body return back
Back
to
to
its
its
natural
normal
state
state.
before you transfer. Of course, there are chances that you achieve
You do
higher
better.
pregnancy rate. Looking at the high progesterone that could be in the system due to OHSS, the high estrogen that you should also have due to the um, lot of responses that you have when stimulating these things. So all these things play a role, and that's why we look at the implantation window that we talk about, where these hormones have a role to play in that for women to achieve success.
Okay. So viewers, hope we are noting all this, and that's why, like we mentioned earlier, you do not compare yourself with someone else
Yeah,
because it's situational. Yeah, it just
situational. Yeah,
depends on the situation that presents. It depends on what's happening per time. If you're someone that's had multiple follicular response from a
yeah.
stimulation and
Or
you are
PCOS in
counseled,
some
yes,
cases.
exactly,
Yeah,
PCOS, and you're counseled that it's better to allow all your hormones to return to normal before having a transfer. That's for your best interest. Of course, in that case, if you obey such counsel, your chances of achieving pregnancy will
pregnancy.
be higher. Unlike if you do a fresh transfer, you don't achieve pregnancy. Of course, you were counseled for the right option, and or someone else that has not so great embryos and wants to have a frozen embryo transfer, and you're telling you this embryo
It's
might
better you
not,
go for a
yes,
fresh embryo
fresh
transfer
embryo transfer, because you're not subjecting them to going through the whole process
process. Yeah.
of embryo freezing. So yeah, in such case, the person that is going to go through a fresh embryo transfer, depending on the embryos, might actually achieve success from the fresh embryo transfer as compared to a frozen embryo transfer. So it's actually situational. That's why trust your fertility specialist to give you the best of counsel and hope for the best out of it. Yes, there's no rule that says when you follow all this, it's going to be that way.
Exactly. Yeah.
But yes, with experience over time, you
Over
can
time,
only
yeah,
hope
shown
for the
that this
best
is
that
should be
works.
better.
Okay, so well, what's your counsel to people in general with respect to the fresh frozen embryo thing?
So, my counsel is to listen to their fertility experts because they start this journey with you. You are being assessed, and from your assessment to the downregulation, the stimulation, the collection, there are a lot of information that they have that you are not privy to. So those information are those that form the basis of deciding whether you advise a patient to go for a fresh embryo transfer. Of course, that's if the person is not doing a PGT treatment, and their condition, whether there's presence of PCOS, whether they have those conditions. So those are things that you look at as an expert to advise them. Okay, with this condition and what we have, we advise that we go for a frozen embryo transfer. With this and the quality of embryos we have, let's go for a fresh embryo transfer. So trust your fertility specialist to always carry you along in these processes. And at the end, of course, ours is to advise the patient on what they need to do. The patient will finally tell us what they need to do. You can cancel the patient. Okay, we advise you, let's go for a frozen embryo transfer. You know, it can be very devastating for someone that's hopeful. I
Yeah.
want to have an embryo, get
Yes.
pregnant. Then you're telling me, okay, this stops now.
Exactly.
Then we'll pick up some other time when your body is fine. Of course, the emotional, the mental, and all those things is part of it.
Yes.
But trust your fertility specialist. Of course, if they're experts in the field, to always advise you to take the right decision. So all these solutions are available in order for you to come and achieve what you desire at the end, which is pregnancy and life better at the end. So trust them to actually do that for you.
Okay, so one last question. Well, I know that some people might just be wondering, this everything that has a positive has a negative. Is there actually a side effect to embryo freezing, or are there times that you freeze embryos and it's not all embryos that survive freezing? What could be a possible reason for them not
So,
to
so
survive
before
freezing?
now, when there's not been advance in vitrification technology,
Yeah.
you can freeze embryos and few survive. But now with the advance in the cryoprotectants, the media being used, then the technical expertise of the person carrying out the procedure.
Yeah.
Of course, there are medias that they tell you once everything is done properly, 100% survival rate is guaranteed. Yes. So in our facility, once embryos are chosen to be frozen, they all survive.
Wow.
Yes. So we have 100% freezing thawing rates
Make
over here in the hospital. So once we pick your embryos, we look at them, analyze them, assess them that these embryos are good for freezing.
freezing.
They can survive all these things. We also have 100% chance of surviving. And these babies that come out of here are normal babies. There's no need to be afraid. They are normal babies. They are fine, no any health issues, normal like every other baby there. In fact, if you bring a frozen embryo baby and a fresh embryo baby, they are all normal babies
Oh.
living their life.
And the live birth for fresh embryo transfer, frozen embryo transfer, it's is it comparable? Is
So
it
yeah, yes, it's comparable. In some cases, like I say, when you look at it, of course, looking at the condition of the patient, yes. Apart from the preeclampsia I talk about, the low
yeah,
birth weight,
yeah.
that frozen embryo transfer makes the patient less susceptible to all these things. So
No,
at the end, yes, more pregnancy and more life path
live
at the end.
birth.
So some research has shown that yes, with that, this is possible.
Okay, so viewers, this is the much we do for frozen embryo transfer. I know that yes, a lot of people would be having concerns, or you're just wondering how frozen embryo transfer, how the embryo is actually surviving. I'm sure a lot of you have so much going on in your head. You just wonder how technology has made this so easy. Well, yes, I'm seeing some comments like just seeing Mary says the session is very impactful. Yeah, I hope that you're able to get all the information that you need with respect to frozen embryo transfer. And it's important to note that wherever your embryos are in the world, maybe you should talk a bit about that.
Yeah.
Mm.
So wherever your embryos are in the world, we can receive them. We receive embryos from different parts of the world, from US, from UK, from Germany, from Qatar, from Finland.
Oh.
So depending on wherever your embryos are, we can always receive them here, and you can have your frozen embryo transfer in any of our facility, whether it's in Abuja or in Jos. So we receive all those embryos from whichever part of the world. Just give us a call. We start the process and
Mm.
receive the embryos. We receive embryos from different parts of even from Canada. We
Mm.
receive
Wow.
frozen embryos. The patients were treated in those countries
Yeah.
and their embryos were
Okay.
shipped back to us. So yes, we've done that, and God has helped us achieve good number of successes with
Okay.
all those things. So there's no need to worry. Wherever your embryos are, you want to just come have them here, or probably you're coming into the country for holidays. Of course, you can bring in your embryos for us. We assess them, and then you have your frozen embryo transfer, and then we wish you all the very best.
So viewers, is where mentioning that embryos could be moved is garbage in, garbage out, because they should not generate something that is not in
Exactly.
the
Yes.
best, and then you expect magic to
Magic to
happen.
happen.
It's
Yeah.
more like what you're shipping that will be transferred. It's not like the facility will alter what has already been
Mm-hmm.
generated. If it's maybe oocyte now,
Oocyte,
for
of
instance,
course.
or
Yes.
sperm,
Then
you
there's
might say,
a
okay, maybe there's a role the facility
to,
has
yeah.
to play with maybe treating and all of that. But when it's already embryos generated, they can only just prepare your body to receive what has been generated. So we can only hope that what you send to us is what
Of good
is
quality.
good
Yeah.
enough to achieve
And
pregnancy.
definitely we carry along once we tour, we give you the information from the reports that we receive from them and what we're seeing. We tell you the updates on what the embryos look like,
Mm.
and then we decide what next you want us to do.
So, Linda, I hope this answers your question, because I just saw she asked if embryos could be moved from one clinic to
Yes,
another.
definitely
So,
embryos
I
can be
believe
removed.
you've addressed your questions. It's
But it
been
is also important to note that you don't carry embryos. There are couriers that carry embryos, and there are
mm,
special
modalities to
cryo
moving them.
tanks that is used to transport these embryos. You
Mm.
don't just go to the hospital and say, "Give me my embryo," and they,
Embryos
of course,
directly.
it doesn't work that way.
Mm.
There are logistics that take care of moving and shipping of embryos,
And that's
not
why.
just embryos, sperms, oocytes, and oocytes. So,
So when they are calling money for you, also know that it's because of the process involved.
yeah.
Somebody is not trying to extort you. It's easier to even move the body than to move the embryos.
Oh yes, it's easier. Yeah, yeah,
So
yeah.
it's good for you to know that when you see them or when you hear them calling some amount of money from wherever center you're moving it to, it's not because they just want to charge you, it's because of the whole process involved. Thank you so much, Mr. Steven, for
Thank
this
you.
wonderful and informative session. I believe our viewers had a good time. I mean, it was engaging. We could see some of their comments and their questions coming in. Thank you so much, viewers. I hope that you have a lovely weekend, and I hope that you also had a very nice time with our session today. Please continue to stay tuned, continue to follow up on our various handles, watch out for our videos, our posts, and various informative um, posts that we make just to keep you informed, to keep you up to date with what's happening. We hope to see more of you in our next session, and we hope that you enjoy the rest of your weekend. But for now, have a lovely evening. Bye.